Come in.
Hi, I'm Emerald. I'm going to be your nurse for today, all right?
Okay.
All right. Can I have your name and date of birth, please?
Mr. Valentine, 8/28/68.
All right. Awesome. So the purpose of my visit here today is to educate you on two of your meds, metoprolol and insulin glargine.
Okay.
Your roommate's a little noisy. Do you want to go to a different room?
Yes, please.
Okay. Is this a better room for you?
Much better, yep.
All right. I do know that you forgot your readers and your farsighted, so I printed out a list of your medications and other instructions, and I put that in bigger font so you could be able to read that. All right. And are there any barriers that would impede you from taking this medication? All right. And any cultural considerations to take into effect?
Nope.
All right. Awesome. So I created a nursing diagnosis for you, and it is decreased cardiac output related to inadequate blood supply as evidenced by your heart rate of 50 to 80 beats per minute.
Okay.
The long-term goal then for you would be that you would maintain an adequate blood supply and cardiac output for at least a year.
Okay.
And then for your 3 short-term goals, your first one would be to make sure your skin stays warm and dry for at least the time while you're in the hospital.
Okay.
The second one would be to make sure your heart rate and blood pressure remain stable while you're in the hospital.
Okay.
And for at least a couple months after. And then the third short-term goal would be that if you experience any side effects such as nausea, vomiting, drowsiness, memory loss, nervousness, to make sure you let a healthcare provider know.
Okay.
Okay? And then metoprolol is the generic name for Lipressor, which is the brand or the trade name.
Okay.
So you might hear both. Okay? Metoprolol is to slow down the heart and prevent you from having another heart attack.
Oh, okay.
Okay? So some side effects of this drug is nausea, vomiting, weakness, memory loss, drowsiness, depression, like that. And then you want to be careful to not operate a vehicle until you know how this drug is going to work with your body.
Okay.
If you have any side effects. All right? And be careful when standing up. Take your time. In case you do have a side effect, we don't want you to fall, okay?
Okay.
All right. Awesome. So metoprolol does interact with your med lisinopril, which you are on for your blood pressure. So with that, you want to be careful that it doesn't increase your blood pressure a lot. And if you notice that it does, please let us know.
Okay.
So that'll also could cause you to fall.
Oh, okay.
The other one, it does interact with your insulin glargine, which I'll be teaching you about.
Okay.
So you want to make sure to check your insulin daily, and it could cause your glucose to drop.
Oh, okay.
And if it does, we might have to adjust your dose. So you want to be careful with coffee, tea, things with caffeine. But let us know if you have any side effects.
Okay, thank you.
You want to make sure to take metoprolol. You'll be taking it metoprolol 25 milligrams by mouth daily, and you don't want to crush it or anything. You want to make sure it's better to take it at the same time every day so you do not miss any doses.
Okay.
Okay? And if you do stop taking this, it could cause an increase in your heart rate and things like that.
Okay.
All right. Sounds good. So now are you ready to learn about injecting the insulin?
Yep.
All right. Sounds good. So, do you have any questions?
No.
All right. And do you remember any side effects that I listed about the metoprolol?
Dizziness, nausea, vomiting, depression.
Very good. All right. So this is our self-injecting pad, which we're going to use instead of sticking you.
Okay.
We're just going to practice on this. So I'm going to show you, and then you'll teach it back to me.
Okay.
Okay? So we have our injector pad. We have our 30-unit syringe. You're only taking 10 units. And this is a 23 to 25 gauge needle.
Okay.
We We also then have your vial of insulin. I have 2 alcohol pads for you and 2 for me.
Okay.
One we'll use on the top of your vial and the other on your self-injecting pad or your skin at home. I have hand sanitizer here. Gloves, if you don't have them at home, it's okay. Just make sure to wash your hands.
Okay.
And then this is a sharps box. So, do you have one of these?
No.
Okay. So if you don't have one of these at home, you can use an empty milk jug.
Oh, okay.
Just make sure it has the cap when you're getting rid of the whole jug, or a detergent container.
Okay.
Okay? And make sure not to stick your hand back in there. You don't want to stick yourself if the cap isn't on properly.
Oh, okay.
And I'll teach you how to use the scoop method so you don't prick your finger.
Okay.
All right. So first I'm going to wash my hands. I'm then going to apply gloves, which, like I said, you don't have to if you don't have them at home.
Okay.
You want to make sure there's nothing else like on your table at home. That way you don't get confused or lose anything.
Okay.
So you're going to take one of your alcohol pads and you're going to wipe the top of the vial with it and let that dry. While that's drying, you're going to wipe the injector pad or your skin, and you're going to do that in going from the outside, well, the inside to the outside.
Okay.
Going in like a circular motion like this. Okay? So now, I'm going to draw up 10 units of air. Let me know if you have trouble seeing. All right. I'm then going to uncap my needle. And I'm going to take this and I'm going to push in the needle. And I'm going to administer that air.
Okay.
Right back in. I'm then going to flip the vial over. And I'm going to take out 10 units. Okay. So it should be right where the black line meets the other.
Okay.
Okay. So then this will be dry. Take that out. You're gonna this is for a subcutaneous administration.
Okay.
So that means you're gonna be applying this at a 45 to 90 degree angle, okay? And you'll be taking this every day at noon.
Okay.
The 10 units. So you're gonna squeeze your skin, and you can do this as I forgot to mention, you can do it on your lower belly, abdomen area, your thigh part, or the back of your arms. That might be hard, so a lot of people like the belly.
Okay.
But make sure to rotate your sides, especially if you see any redness or swelling.
Okay.
Okay? So you're going to squeeze the skin. Like I said, apply it like a dart. Push it in. Push it down. So it's at a 45 to 90 degree angle.
Okay.
Release and take out.
Okay.
You're then going to scoop. This is the scoop method, making sure it's on, and just click it.
Okay.
Okay? Then you would put that right back into the thing. Okay?
Okay.
Can I have you
Sure.
this? Would you like gloves or sanitizer?
I'll have both.
Okay.
So I sanitize first. Get my gloves. And I'm going to open my alcohol prep pads. I'm going to clean the top of the bottle. And I'm going to clean this from the inside out. And then I draw back 10 units to the line.
Now inches of your air.
Okay. And then uncap.
Yep.
And then I squeeze my skin, either my abdomen, arms, or legs.
Yes.
Okay. And then
make sure to get your insulin.
Oh.
Very good. You're good.
Oh. Inject my air.
Yes.
Draw back my insulin at 10 units.
Yes.
Okay. And then I'm going to pinch.
Yes.
Inject at a 45 to 90.
Correct.
And then release.
Very good. And then how would you put the cap back on?
So I'm going to lay it like this, and then I'm going to scoop it up till the needle's inside, and then close it.
Correct. And then you can just put that in.
Okay.
And do you remember where else you can store your needle?
In a milk jug or an empty laundry detergent.
All right. Very good. Any other questions?
Nope.
All right. Good.
Thank you.
job.